Hi, I'm Delane Cleveland, and in the past few weeks, Minnesota has considerably ramped up testing for COVID-19. Allina Health is one of the healthcare entities that is offering that testing. Joining me now to talk more about that is Sally Wahman, the VP of Primary Care Operations for Allina Health. So first, thank you for joining us today to talk
My
about
pleasure.
that. What exactly is Allina Health doing then to ramp up testing?
Yeah, so we stood up several weeks ago a number of curbside testing sites. We currently have 9 across the 6 across the metro area, 3 in our regional sites, so that we can provide easy access for patients to call or schedule an appointment and come through and get that curbside testing without having to come into the clinic. We are testing symptomatic folks, so people who have symptoms that are consistent with COVID can call and schedule an appointment to come and be scheduled. They stay right in their car, and we're able to do that test. And the results take typically 3 to 5 days to come back. But in the meantime, people can stay home and keep isolated from others, and we're able to get them those results, and so then they can plan from there.
Yeah, you sort of just touched on it, but more about who should be getting tested. Anyone with symptoms, or what is the guidance there?
Yeah, so the governor, we opened that up at the beginning of the month, or at the end of April, actually. Anybody who has symptoms consistent with COVID should be tested, and can call and schedule, make an appointment to be tested.
So tell me more about what this whole process is like if I want to get tested.
Mm-hmm. So typically you would you either be calling your clinic to talk to your provider about your symptoms and make a decision to be tested, or if you just really want to know, you would call a central number that we can provide that you can just get scheduled to have. They'll ask you some questions about what your symptoms are. We'll get you identified to be where's the site that's closest to where you live, and what are the hours that meet your needs, and we'll get you scheduled to come in. When you come to the clinic, we give you a phone number so you can call and let the care team know that you're there, and they'll come out to the car and test you right there.
And one of the things I've heard the governor and the health commissioner, Jan Malcolm, say is that Minnesota has a high capacity to test, but they're not getting everyone in that they'd like. What are you seeing so far in terms of numbers?
Yeah, so we're testing about 600 a day, maybe a little bit less than that, and we could test quite a few more, probably over 1,000. We are meeting most demands same or next day, so people call today, they could probably get an appointment today or tomorrow, and we have room for more. We do provide some weekend opportunities as well, and those are also not fully booked. So I think, like the other systems, people are just not aware that they can get tested, or other reasons that are maybe keeping them from doing so.
All right, now if people want more information, what is the best resource for them?
Yeah, so allinahealth.org is a great resource of all information about COVID related to testing, as well as a whole other list of topics. So that's where, first and foremost, I would suggest people can always call their clinic as well. It's always a good source of information. And a lot of our central resources can help support that too. So we can provide a central phone number, 612-262-4145. That's our scheduling number to actually get scheduled to be tested if people are want to just call.
All right, is there anything else that you wanted to touch on?
I think that's it. We just, if people are out there with symptoms, I think it's really important from a public health perspective to get tested. If you're curious where the closest location is for you, the Minnesota Department of Health has an excellent website that identifies across the state of Minnesota all the places are testing, phone numbers to call, hours of operation. So encourage people to look there as well.
All right, Sally Wahman from Allina Health, thank you so much for joining us.
My pleasure.
All right, take care.
Find more local news stories at ccxmedia.org and follow us on social media.